All right, so let's dive into something that I think hits close to home for probably everyone listening, the cost of prescription drugs in America and how we access healthcare.
Yeah.
We've got a whole stack of articles here, some fresh research, and some of the findings are honestly kind of shocking.
It is pretty eye-opening, isn't it?
Yeah.
There are all these different trends kind of converging right now.
Yeah.
Drug prices are going nowhere, but up. Pharmacies are closing left and right.
Right.
And the whole system feels so opaque, like nobody really knows how it all works.
Exactly. One of the articles here cites an Avitis survey, and get this, it found that nearly half of Americans,
Wow.
48% to be exact, have had to skip filling a necessary prescription just because of the cost.
That's wild.
Think about that for a second. Almost 1 in 2 people, maybe even someone listening right now, has had to face that impossible choice between getting the medication they need and paying for other essential needs.
It is a really tough situation. And honestly, it gets even more concerning when you think about the potential fallout from that.
Oh, yeah.
The CDC found that 9 million Americans are actually stopping their prescribed medications completely.
Wow.
Because of the cost. And so it's not just about the financial strain.
Yeah.
It's like a full-blown public health issue.
Okay, so let's try to untangle this a little bit. Who or what is driving these skyrocketing prices in the first place?
Well, it's definitely a complex issue, but one of the major players that a lot of people might not even be aware of are pharmacy benefit managers.
PBMs.
Exactly. PBMs, they're the middlemen, you could say.
Yeah. Negotiating
drug prices between the manufacturers and your insurance company.
I see.
But here's the thing. That same Navitas survey found that 75% of Americans don't even know what a PBM is.
Seriously. That's a little unsettling to think about, This group has so much power over what we pay for our medications, and most of us are totally in the dark about it. Can you shed a little more light on how they operate and how they're impacting these costs?
Sure. So basically, PBMs manage prescription drug benefits on behalf of the health insurers. They create these things called formularies, which are lists of the drugs that are covered.
Okay.
And they negotiate rebates from the drug manufacturers. And that all sounds good in theory, right? But the problem is the way these rebates are calculated and how they actually get passed on to us as consumers is often really opaque.
So it's not as simple as them just getting a discount and passing those savings directly on to us?
No, unfortunately not. The lack of transparency makes it very difficult to see if those rebates are actually making our medications cheaper or if they're getting lost somewhere along the way.
So this is making me wonder if the lack of transparency itself is part of what's driving prices up.
Yeah.
If nobody really knows how those prices are being determined, how can we advocate for fairer pricing?
That's a great point.
Yeah.
That lack of transparency leaves a lot of room for hidden markups and fees.
Right.
And it makes it really hard for people to shop around and compare prices effectively.
And then on top of all that, we have the issue of drug shortages.
Oh, yeah.
Which are further complicating people's access to the medications they need.
It's a huge problem.
The Wolters Kluwer research we have here indicates that almost a third of Americans have been affected by these shortages in some way.
Wow.
Can you imagine going to the pharmacy to fill your prescription and then finding out that the medication you rely on is just not available?
It's scary.
Yeah, it's stressful and it can be dangerous, especially for people with chronic conditions.
Absolutely.
So we've got this tangled web of rising costs,
right?
These hidden players like the PBMs, and then you add on drug shortages on top of that.
Yep.
What can be done to unravel all of this and make these life-saving medications both more affordable and accessible?
Well, there are some promising solutions starting to emerge, and I think it's important to highlight that some PBMs are acknowledging that they need to be more transparent.
Okay.
Navitas, for example, they're taking steps to be more open about their pricing practices. They even publish an annual drug trend report, which most PBMs don't do.
It sounds like they're trying to move in the right direction, at least.
Yeah, I think so.
Right. What other approaches are gaining some traction in tackling this really complex problem?
Well, technology is playing a bigger and bigger role, and this is really exciting.
Oh.
For instance, there's this company, Peak, that's created what they call a prescription marketplace.
A prescription marketplace?
Yeah, it basically aggregates cash, discounts, manufacturer programs, and even your insurance, copay information to help you find the lowest possible price.
Oh, so it's kind of like comparison shopping, but for your medications?
Exactly. It's all about bringing transparency and competition to a market that has traditionally been shrouded in secrecy.
That's a great idea. I'm also hearing more and more about artificial intelligence or AI coming into play.
Oh yeah, AI is being used to manage spending on specialty drugs more effectively.
Wait, hold on. Before we go any further, can you clarify what specialty drugs are?
Oh sure, sorry. Specialty drugs are medications that are used to treat complex and chronic conditions,
Okay.
like cancer, multiple sclerosis, rheumatoid arthritis, things like that, though.
Yeah.
They tend to be very expensive, and managing them often requires a lot of specialized expertise and coordination.
I see. So how does AI help manage those costs then?
Well, there are companies like Serpasarx and Waltz Health that are developing these AI-powered platforms that can analyze tons of data to identify cost-saving opportunities.
So it's like having a superpowered assistant helping you figure out how to save money.
Right, and these platforms can do things like intelligently route prescriptions to the most cost-effective pharmacies,
Okay.
taking into account things like the patient's location, their insurance coverage, and even drug availability.
Wow.
They can also identify times when it might be possible to switch a patient to a biosimilar medication.
What a biosimilar is.
It's basically a medication that's highly similar to the original brand name drug,
Okay.
but typically much less expensive.
I got it. So it's about finding efficiencies and optimizing the whole process to save money.
Exactly. And it has the potential to make a huge difference, not just for patients, but for the entire healthcare system.
It's pretty remarkable.
It is, and it's still early days, but AI's role in healthcare is definitely something to keep an eye on.
All right, so we've got these promising trends emerging, a push for more transparency and pricing these really innovative technologies like Peak and these AI-powered solutions. But at the same time, we're seeing more and more retail pharmacies closing their doors. What kind of impact is this having on people's access to care?
It's a major concern. These closures are creating what are being called pharmacy deserts.
Pharmacy deserts?
Yeah, these are areas where access to medications is becoming much more limited.
That sounds really bad.
It is. The Wolters Kluwer survey found that 59% of Americans are worried about losing easy access to their medications.
Wow, yeah, that's understandable. It's especially worrisome for people in rural areas or folks with limited mobility who might now have to travel further to fill their prescriptions.
Exactly, and that can create a real barrier to care,
Yeah.
especially for people who are managing chronic conditions.
Yeah. So while online pharmacies might be an option for some people, it seems like many still prefer to have that face-to-face interaction with their local pharmacist.
That's true. Only about 16% of people prefer using online pharmacies, according to that survey.
So there's still a lot of value in that personal connection and the trust that people have built with their pharmacists.
Absolutely.
This makes me think about how we can balance the convenience and the potential cost savings of online pharmacies with the need to make sure everyone has equitable access,
Yeah,
especially those who really rely on that in-person support.
it's a tough balance for sure. We need to consider both the technological advancements and that human element as we navigate all these changes in healthcare.
No easy answers there. It's definitely a complex situation with a lot of moving parts. We have explored the problems, we've uncovered some potential solutions, and even delved into this evolving landscape of healthcare access. But I have to ask, what does all this mean for you, our listener?
It means that you are not alone in facing these challenges. Millions of Americans are dealing with the exact same issues when it comes to prescription drug costs and access to care.
Right.
But the good news is that there are resources and solutions out there to help you navigate this complex system. And it's really important to remember that knowledge is power.
Yeah, knowledge is power.
The more informed you are, the better choices you can make for your own health and well-being.
So you're saying we can't just sit back and be passive about this. We need to be proactive, informed consumers of healthcare.
Absolutely.
Yeah.
You shouldn't just accept whatever price you're given at the pharmacy counter.
Right.
Ask questions, explore different options, and don't be afraid to shop around.
Yeah.
This is where those tools like that Peak Prescription Marketplace can be really valuable.
Yeah. So it's like comparison shopping, but for your medications.
Exactly.
I like that. Are there other things we can do as individuals to kind of advocate for ourselves in this system?
Definitely. If you're worried about rising costs or the lack of access in your community, reach out to your elected officials, make your voice heard. You can also explore alternatives like mail order pharmacies.
Right.
Or telemedicine services, if those are options for you.
So stay informed, explore your options, and speak up.
Yeah.
What about those pharmacy deserts we were talking about earlier?
Yeah.
What can be done to address that growing problem?
Well, awareness is a big part of it.
Yeah.
If you see a pharmacy closing in your community, contact your local officials.
Okay.
Express your concerns about access to medications and, support policies that encourage pharmacies to stay open in those underserved areas.
So collective action can make a difference.
It can.
This is making me think about some of those headlines we've seen lately about these big healthcare partnerships.
Yeah.
These huge collaborations between like Berkshire Hathaway, JP Morgan Chase, even retailers like Walmart and Walgreens.
Right.
But I recall some of them haven't exactly been a smashing success.
That's true. A lot of those ventures have struggled or even failed altogether.
Yeah.
Which I think really highlights the fact that healthcare is fundamentally a local and personal issue.
Mm-hmm.
These one-size-fits-all approaches often miss the mark when it comes to addressing the unique needs of individual communities.
This brings to mind another article we have here that highlights a very different approach. It's about Gwinnett Clinic in Georgia, which partnered with Better Health to create a patient-centric insurance plan that really prioritizes local care.
Interesting.
It's almost like a counter movement to those giant healthcare corporations.
Yeah, I think they're recognizing how important that local connection is and the value of a more integrated approach to care that's tailored to their community's specific needs.
I see. So this all points to a need for more creative solutions that put patient needs in those local communities first.
Right.
What stands out to you as we look at all these different approaches to healthcare?
I think it's really interesting that we're seeing a shift away from thinking about healthcare as just a transactional process.
Oh, yeah.
There's a growing understanding that healthcare is about more than just treating illness.
Okay.
It's about building those relationships, fostering trust, and empowering people to really take control of their own well-being.
Speaking of taking control, I'd love to dig into a topic that I'm really passionate about, medication safety.
Okay.
We have some fascinating material here from SureScripts.
I've heard of them.
They're a company that's working behind the scenes to make medication histories more accurate and complete.
Yeah, that's so crucial. Having a complete and accurate medication history is absolutely essential for patient safety.
Absolutely.
And to ensure that care is coordinated,
Right.
especially as patients move between different providers in different healthcare settings.
Yeah, it's like connecting all the dots in a patient's healthcare journey.
Exactly. And
Yeah.
SureScripts has this solution called Medication History for Populations, which gives care management teams a really comprehensive view of their patients' medication data.
Wow.
And this can help identify potential gaps in care,
Right.
drug interactions, opportunities to improve medication adherence, all sorts of things.
That seems especially important for managing those chronic conditions.
Yeah.
And for people who see multiple specialists.
Definitely having that holistic view of a patient's medication history can help prevent those adverse drug events.
Right.
And ensure that everybody involved in a patient's care is on the same page.
Makes sense. It sounds like SureScripts is playing a really important role in supporting these population health initiatives.
They are.
That are aimed at improving outcomes for entire communities.
It's amazing. And they're just one example of how technology is being harnessed to tackle some of these systemic challenges in healthcare.
Yeah, so we've covered a lot of ground here, from rising drug prices and pharmacy closures to these cutting-edge technologies like Peak and AI. And even SureScripts' work on medication safety. It's clear that this whole prescription drug landscape is constantly in flux.
It is. But while there are definitely challenges, there's also reason to be optimistic.
I agree. We're seeing a lot of creativity and innovation emerging to address these issues.
And ultimately, it's that ingenuity and that spirit of collaboration that will lead us toward a more equitable and accessible healthcare system.
Well said. As we wrap up this part of our deep dive into prescription drug costs and access in America, what's the key takeaway you want our listener to walk away with?
I think the most important thing to remember is that you are not a passive bystander in this system.
Okay.
You have a voice and you have choices.
Right.
And by staying informed, asking questions, and advocating for yourself, you can navigate this complex landscape and make the best decisions for your own health and well-being.
That's so empowering.
It is. And as you continue to navigate this evolving landscape, here's something to ponder.
Okay.
We've seen how technology is playing a bigger and bigger role in healthcare. From AI-powered platforms to prescription marketplaces and tools that enhance medication safety. But will these innovations ultimately lead to a more equitable and accessible healthcare system for everyone? Or will they create new disparities and new challenges?
That's a really thought-provoking question.
It is, and it's one that we'll continue to explore as this story unfolds.
That's a really important question to consider as we move forward. So With that, we've reached the end of our deep dive into prescription drug costs and access here in America.
Wow, it feels like we just got started.
I know, right? We've covered so much ground, from those rising prices and the role of PBMs to the impact of all those pharmacy closures and the emergence of these innovative solutions like we talked about.
Yeah.
What are your final thoughts for our listeners as they try to navigate this really complex and constantly changing landscape?
Well, I think the most important thing to remember is that you're not alone in this. Millions of Americans are facing these same challenges. And there are resources and strategies out there to help you make informed decisions. Don't be afraid to ask questions, advocate for yourself, and explore all of your options.
I couldn't agree more. It's been a fascinating journey exploring this topic with you.
Yeah.
And I really hope our listeners are feeling more empowered and informed after joining us on this deep dive.
Me too. And remember, this healthcare landscape is constantly changing, so stay curious, stay engaged, and stay informed.
Well said. Thanks for joining us on this deep dive into prescription drug costs and access in America.
It was my pleasure.
Until next time, stay curious and take care.